Hello and welcome to the topic Biliary Disorders in the module Gastroenterology and Hepatology. By the end of this topic, you should be able to define biliary disorders, explain the pathophysiology of biliary disorders, describe the clinical presentation of biliary disorders, outline the investigations in the diagnosis of biliary disorders, and finally discuss the management of biliary disorders. Let's get started. Biliary disorders or diseases include diseases affecting the gallbladder and the biliary tract. Biliary diseases also refer to diseases affecting the biliary duct and other structures involved in the production and transportation of bile. Bile is a fluid produced by the liver that aids digestion. So again, biliary diseases refer to diseases affecting the bile ducts, gallbladder, and other structures involved in the production and transportation of bile. These conditions include gallstones, acute calculous cholecystitis, acute acalculous cholecystitis, Mersey syndrome, chronic cholecystitis, cholangitis, biliary tract malignancies, biliary tract cyst, and many others. Infection is generally secondary to predisposing factors. So ascending cholangitis is usually due to bacterial infection of the biliary tract. It results from bile stasis due to chronic obstruction, usually by stones. Biliary obstruction due to gallstones causes up to 80% of all cases of acute cholangitis. And this can eventually lead to biliary sepsis. Sepsis of the biliary tract is a severe disease due to its cause and its significant association with relevant diseases, either benign or malignant, of the biliary tract, pancreas, and hepatic hilus. So as we have seen all the other diseases that are under the topic of biliary disorders, so here you may want to think about what are the symptoms of a person having biliary disorders. Let's begin with the general symptoms. One may have nausea or vomiting, feeling fatigue, loss of appetite, and sometimes itching. More specific symptoms would be, or signs would be, jaundice, one having fever or chills, and this could indicate an infection, abdominal pain, which is focused more over the right hypochondrial region, and if the patient has brown urine, dark brown urine, or pale stools, that could indicate a presence of cholestatic jaundice. Now, a person with biliary colic typically feels pain in the mid to right upper abdomen. The pain can be felt quite sharply, crampy in nature, or like constant dull ache. Colic often occurs in the evening, especially after eating a heavy meal. When it comes to investigations, we want to focus on the blood tests that can assist with our diagnosis. A full blood count is done to look at the presence of leukocytosis, which may indicate an infection. Other than that, you could also perform a liver function test. Patients with partial bile duct obstruction have elevated serum alkaline phosphatase and gamma-glutamyl transpeptidase. The serum of patients with clinically apparent jaundice shows increase in total and conjugated bilirubin levels. Alkaline phosphatate levels are increased to more than 3 times upper limit in cases of obstructive jaundice. When it comes to imaging studies, ultrasonography is the most common test used in the emergency department for the diagnosis of biliary colic or any other biliary disorders. This imaging modality may be diagnostic for biliary disease, help exclude biliary disease, or may reveal alternative causes of the patient's symptoms. The ultrasound will show that the small bile ducts have become larger. This is called dilatation of ducts. The small bile ducts are located behind a blockage of one of the larger bile ducts. You can also do a cholangiography. A cholangiogram is an imaging test that looks at the bile ducts to see if they are blocked, narrowed, or dilated. This can help show if someone might have a tumor that's blocking a duct. It can also be used to help plan a surgery. Other modalities, which are functional modalities such as magnetic resonance imaging, endoscopic retrograde cholangiopancreatography or ERCP, also can be used. So how is biliary diseases treated? Now, it depends on what exact disorder that we are talking about, but generally, medications or antibiotics are given in cases where there is an evidence of infection. Hepatoportoenterostomy is another method of draining the bile from the liver when bile ducts are blocked. So this is more of a surgical intervention rather than a medical intervention. When it comes to treatment, can be further divided into medical and surgical therapy. So for medical therapy, we'll focus on medications that help increase flow of bile from the liver, as well as antibiotics that help in treating infections. Secondly, we want to look at surgical interventions that can help drain bile from the liver when the bile ducts are blocked, and this is what we call hepatoportoenterostomy. Now, to summarize, we have looked at all the different types of biliary disorders. We have looked at the pathophysiology of these individual biliary disorders, the general clinical manifestations that a patient may come in with, the investigations that may help with identifying the problem as well as gauging the severity of the disease, and finally, medical as well as surgical management for biliary disorders in general. We have come to the end of this topic. Thank you.